Welcome to Adapt NCLEX. Insulin questions shows up on the NCLEX and the nursing school exams. Stick around, let me give you 10 yield questions on insulin types, side effect, and dose calculation that you need to know for your NCLEX and nursing school. First question, a nurse is teaching a client newly diagnosed with what? Type 1 diabetes about Lispro. Which statement indicate correct understanding of the teaching? What do you need to know? Buzzword. The buzzword in the question is Lispro. What is Lispro? That's all you need to know. That's test-taking strategy. How do you answer the question? Keyword is Lispro. Lispro is what? What do you think it is? If you know what it is, then I should inject Lispro what? 30 to 60 minutes before eating. Lispro what? Works within what? 15 minutes of injection. Lispro is usually given once daily at bedtime. I should expect Lispro to last what? 24 hours. What do you think? The key, like I said, is Lispro. And that is what all you need to answer the question. And that is what is a rapid acting insulin. If it's a rapid acting insulin, it's going to act fast. As soon as you give it to the patient, it's going to start working. What is the onset of that medication? 10 to 15 minutes. If it's going to act for 10 to 50 minutes, then number 1 is wrong answer. Number 3 is the wrong answer. Number 4 is the wrong answer. Know the onset, know the peak, and know the duration. I'm going to give you key concept that you can use to answer these questions. As you can see, Lispro works within about 15 minutes of injection. 30 minutes to 60 minutes before eating. If you give it to the patient, look at the peak. The peak is 1 hour. If you give it to the patient, at that peak, the patient is going to be, the patient will be hypoglycemic before they eat. That's a wrong answer. Correct answer is what? Number 2. This is where you answer questions related to insulin. Number 2 is your right answer. Which finding indicates side effect of insulin? That means, how do you know this is a side effect of insulin? And next, monitors a client who received what? Regular insulin 2 hours ago. Which of these indicates side effect? Shakiness and tremor, increased thirst and urination, sweating and irritability, confusion and headache, warm, dry skin. There's a strategy here. I give you insulin. Which of these indicates side effect? What is the question asking you? If you break it down, you know that the question is asking you about hypoglycemia. Because if I give you insulin, you're going to be what? Hypoglycemic. How do you know I'm hypoglycemic? I call it what? I call it cold and clammy is hypoglycemic, and hot and dry is what? Hyperglycemic. Which of these signs and symptoms indicate cold and clammy? Shakiness and tremor is a bad thing. Increased thirst and urination is consistent with what? Hyperglycemic symptoms. Because if somebody is in DKA, you see them with urination and thirst. Sweaty and irritability sound like cold and clammy, shock-like symptoms. Confusion and headache sound like cold and clammy and shock-like symptoms. When your skin is dry and warm, it's called what? Hot and dry, and that is what? Hyperglycemia. Therefore, what are the signs and symptoms of hypoglycemic? Shock, shakiness and tremor, sweaty and what? Irritability, and confusion and headache. 1, 3, 4 are your right. This is a dose calculation strategy. If you've seen this question before, I'm going to make it easy for you. You may have seen it before and you think it's a hard question. Look at it. Provider prescribed what? 0.1 units per kilo to a patient who weighs 176 pounds before meal. How much insulin should the nurse administer? The first thing you need to do is to convert the pounds into kilos, right? The pounds into kilos, because the unit, the prescribed dose that was given is what? 0.1 per kilos, 0.1 unit per kilo. Therefore, 176 pound over 2.2 is going to give you 80 kilos. So this patient is 80 kilos. If 80 kilos is the weight of the patient, I'm supposed to give what? 0.1 per kilo of the patient. Therefore, I write 0.1 unit over kilos times 80. That's all. And I can say kilo over kilo. Therefore, the nurse is supposed to give 8 units per dose. If you see this kind of question, step back, understand what is prescribed and what is ordered, and convert your unit so that it can satisfy the question. If you need more, check Adapt NCLEX. I have more of this for you. And then prepare to mix NPH insulin and regular insulin in the same syringe. Which action is correct? I need you to stop the video, put your comment, which answer choice you're going to pick. I know you know the answer, but be careful because sometimes what you're expecting will know what they will give you. NPH, what do you do? Mixing NPH in insulin. Draw NPH first, then regular insulin. Draw the clear solution first, then cloudy. Use separate syringe for each insulin. Shake NPH vigorously. Like I said, stop the video, put the answer in the comment, and let me know what you think so that I can see how you're thinking. But you should know, shake NPH vigorously, rub it between your two palms. You separate syringe for each insulin. You're mixing the insulin, so you're supposed to use the same insulin. Draw clear solution first, then what? Cloudy. Regular insulin is the clear solution, and the NPH is the cloudy. The mnemonic is what? RN. Registered nurse, right? That means regular insulin before NPH. Number one is wrong. Draw NPH first, then regular insulin is wrong. Therefore, the right answer is to draw a clear solution and a cloudy. I did not use the insulin or NPH, but I'm trying to let you think so that you can make yourself flexible in nursing school or NCLEX when you see this pharmacology question regarding insulin, side effects, and dose calculation. A client receiving insulin therapy as what? Tremor, sweating, and confusion. Those are buzzwords. Those are the things you're supposed to focus on. Don't go away from it until you know what it means. These are what? Signs and symptoms of what? Hypoglycemia. What is the next priority action? Patient is hypoglycemic, you know they need insulin. Which one would you pick? 15 grams of carbohydrate snack, right? In answering questions regarding hypoglycemia is to what? Two things. Ask yourself, is this patient conscious or unconscious? The patient has tremor, is sweaty, and confused. This means the patient mental status is compromised. You should never put anything in their mouth. Therefore, number one is wrong. Even though it's good to increase their glucose, the patient is what? Confused. It's going to affect their airway. The patient is confused and not stable enough to take anything orally. You should find another route that does not involve oral means. That means IV or IM. Giving them scheduled insulin is going to worsen the hypoglycemia. Notify the ACP you can do something. Administer IM glucagon is the best answer. Therefore, watch for this kind of question where you have to think critically. Therefore, number 4 is the right answer. Hypoglycemia signs with confusion, you give them IV or IM and source of glucose to improve their glucose level. Which respond by the nurse are correct. This is sick day. What do you tell a patient who has type 1 diabetes about sick day? Stop taking your insulin until you eat normally. Check your blood glucose more frequently. Continue insulin as prescribed. Take double dose of your insulin. Limit fluid intake. Check your urine for ketones. Stop the video. Put down your answer. Let me know what you think. What do you think? The sick day is a major problem. These questions will show up on your NCLEX whether you like it or not, either in the case form or on this kind of question, because this is the major problem that usually causes issues with patients with type 1 diabetes. In sick day, stop your insulin until you eat normally? No. You should what? Check your blood glucose more frequently. Number 2 is right. Continue insulin as prescribed. Yes, even though you are not eating, you need to take your insulin. Double dose your insulin dose? No, you become hypoglycemic. Limit fluid intake? No, you should hydrate yourself so that you don't get DKA. The glucose that build up, if there's no insulin, will cause dehydration. Check your urine for ketones. That shows that you are in DKA. Therefore, the right answer is what? Number 2, check your glucose more frequently. Continue insulin as prescribed and check your urine for ketones. 6 questions. What is your score? I know you're doing well. I know you watch Adapt and class. What is your score? Put down in the comment. Tell me you're ready for the next 4 questions. In the 6th day, the mnemonic is what? Sugar check, insulin continue, carbs, and ketones is a mnemonic. Number 7, a client is prescribed what? 70/30 insulin, NPH regular, 40 units before breakfast. How many units of regular insulin would the client receive? This question is not that difficult. Don't let it trick you. Don't run away from it. Step back. I've given you the answer. But if you look at it carefully, you think it's a difficult question. If you see this in the nursing school or on the NCLEX, this is the way you approach it. They want to find out if you can critically think. And what is that? I give you 70/30 insulin. That means there is 70% of NPH, right? And there is 30% of regular insulin. All you need to do is to find what? 30% of what? Regular insulin, because the question asks how many units of regular insulin. So 30 over 100 times what? 40. That will give you what? 12 units. The nurse is going to mix 12 units of NPH. NPH, you just have to find 70% of what? 40, which will give you what? 28 units. If you add them, it will be total of 40 units. Therefore, the nurse is going to mix 28 of NPH and 12 units of insulin to give you the 40 units. The question is asking how many units of regular insulin would the client need? Just 12. That's the right answer. Straightforward. And this is the concept. Pre-mixed insulin shows percentage first. So NPH, and the second is the regular insulin. Number 8, NS administer NPH at what? 8 o'clock. At which time is the client most at risk of hypoglycemia? Look for the peak. And the middle of the peak or the beginning of the peak is the time you see the patient, is the time the patient is going to be hypoglycemia. Hypoglycemic. What is the peak of what? NPH. And this is the key. 2 to 4 hours is the onset, 4 to 12 is the peak, and 14 to 24 is the duration. Therefore, 8:30 is too early. 10 o'clock is not even at the beginning of the peak. That's the onset. 1 o'clock is in the middle of the peak. 2000 is past that. That is the peak, the duration of the medication. And therefore, you should see the patient at 1 o'clock. Always use the peak as the time of which you're going to cause hypoglycemia. If the question asks for priority, that's what you're looking for. This is rapid fire on insulin, pharmacology, side effect, and dose calculation. Therefore, in this situation, we're going to see the patient at the peak. You make sure you take the lowest side of the peak. And when you add even the lowest, 4 times plus 8 is 12. Therefore, the minimum time you're going to see this patient is at 12. You can see them at 1 o'clock, but don't wait until after 12 hours. And that's the key concept. And hence is reinforcing teaching about insulin glargine, which statements show correct understanding. Once again, another insulin question. Always go for the concept. Which of these answer choice will you pick? I will take this insulin at bedtime and it will take what, 24 hours. Does that consistent with glargine? I will mix glargine with what, NPH insulin. I will take this insulin before every meal. I will expect a peak effect in 2 hours. What is the concept? Glargine is long lasting. It has no peak. It lasts for 24 hours and given once a day. Therefore, you should not expect a peak at 2 hours. I will take the insulin before meal. You don't need to take it with meal. You can take it with meal or without meal. You don't need to mix with it NPH. The only thing that you can mix with NPH is regular insulin. Therefore, number 1 is the right answer. Last question. What is your score? Let me know your score. Put it in the comment. This is rapid fire, NCLEX pharmacology, insulin, types, side effect, dose calculation, mastering, endocrine, pharmacology. And A nurse is teaching a client about what? Insulin storage. Which statement requires further teaching? I will keep open vial under direct light to keep it active. I will keep open insulin vial under direct light to keep it active. I will keep on open insulin vial in the refrigerator. I will keep my open insulin vial at room temperature for about a month. I should avoid freezing my insulin supply. Which statement requires further teaching? There's a concept associated with insulin storage, and this is it. Insulin should be what? Stored in refrigerator if it's not open. If you open it, keep it in room temperature, it can last for 30 days. You should avoid it on sunlight and freezing. Therefore, which one needs further teaching? I will keep an open insulin vial and the direct light to keep it active. These are 10 questions on insulin, pharmacology, side effect, dose calculation, strategy for your NCLEX and nursing school. This is what is going to show up on the NCLEX. These are test-taking strategy, critical thinking. Thank you for watching. And if you need more, check Adapt NCLEX for more content like this. If you like this video, share with your friends. But this is concept that you have to master for your NCLEX and nursing school. Take care of yourself. Bye.